This is Hazel.
And this is Batman.
Hello, Batman.
Hello, Hazel. Well, I'll pop her back. She's most annoyed that I've pulled her out of a nice, sunny, cozy spot. Gemma, thank you so much for joining us for this get to know you little interview. I'll get right into it. Tell us a little bit about yourself.
Well, I'm Gemma. I graduated from Massey University in 2009, and at that time I really wanted to be a surgeon, and I left uni thinking I was going to be gung-ho, cutting everything, really super excited. But then after getting into general practice, I realised that I actually really enjoyed veterinary medicine, and I really enjoyed getting to know clients, talking to them, getting to see them at revisits, seeing the continued progress of their pets. And so after that, I decided to try and sort of specialise and spend more time in specialist centres where I could see a higher level, I guess, of veterinary medicine. So I did an internship at Sydney Uni, and then got a residency in Brisbane, where I've stayed ever since.
Oh, that's fabulous. Did you have a mentor early on in your medicine journey whom you really looked up to and followed?
I remember having a case when I was a new grad. I think I'd only been working for about 3 weeks. It came in, had back pain, had a fever, wasn't eating, and really just I had no clue what was wrong with it. None of the other colleagues in my practice could get to the bottom of what was wrong with this dog. And in the end, I ended up referring it to Rob Lebuck, who was just really so kind and patient, and it explained the whole case to me. And it had immune-mediated neutropenia, which is really quite rare, but it was just that interaction of someone who was so kind, so knowledgeable, and took the time to explain it to me. And, you know, I could really see the value that my client had gotten out of that, you know, being referred, spending that time with a medicine specialist. So Rob Lebuck doesn't even know that he's my secret mentor, but yeah, I really appreciated that. And in my second year of being a vet, I decided to do more continuing education in medicine, and so just did lots of sort of distant education courses and things from there. And I guess everyone that I've sort of worked with, you know, most of the Australian fellows in medicine I've got to know, and they've all been so kind and willing to help.
Oh, that's amazing. Gemma, what are your favourite things about your working day?
I'm lucky because I get to take my dog to work, so I enjoy taking Hazel to work with me every day. I really enjoy spending time with my colleagues. Every morning at the practice I work at, we do morning rounds with both the surgery department and the ophthalmology department. Really enjoy getting that case interaction, everyone talking about their cases. I like spending time with the residents, teaching them, but most of all I really enjoy seeing the patients, seeing your regulars come in each week, knowing their clients and, well, their owners, sorry, and just getting to know, you know, the owners and really the pets, and seeing the pets progress. That's the best part.
That's really, really great. And Gemma, what do you do to unwind? What do you do for fun?
I really like to cook and pretend that I'm a master chef. I do bushwalking, and my secret job that I'd do if I wasn't a vet would probably be a florist.
Oh, that is amazing. Do you do floral arrangements as a hobby?
Yeah, I do, yeah.
Oh, that's great. That's great. Well, on the 24th of July, as part of the online vet conference, you are speaking on immune-mediated thrombocytopenia. Could you tell us a little bit more about your topic?
Yeah, so immune-mediated thrombocytopenia is, I think, a little bit more common than what people really recognise, and it can be quite scary when you're faced with it, if it is in an emergency situation, if you've got a patient that's hemorrhaging, and all your sort of routine coagulation tests and everything come back normal. So I think it's an important disease to be able to recognise quickly, kind of have the confidence to diagnose and then know how to manage in an emergency setting, but then also long term. It does involve, management with immunosuppressive drugs, which can have some complications. So it's important to understand the long-term management.
Oh, we're really looking forward to this, Gemma. We have over, at this point, 3,000 vets and
wow,
for this conference. So
you make me scared.
So everybody, this is Dr. Gemma Burney. Thank you so much, Gemma, for joining us today. Gemma will be speaking on the 24th of July at the Online Vet Education conference, which is a 2-week online event. It's held every year and it starts on July 22nd, goes all the way for 2 weeks till August 1st. And we have 2 webinars a day, at 12 p.m. and at 7:30 p.m. again. And the best part, it's all online and you can watch it from the comfort of your home or at the clinic with a whole bunch of friends and colleagues. So we'll see you soon and we'll add some details about the program just in this post. Thank you so much. Thanks, Gemma.
Thank you.
Let's cut. Hey, that was